Hello everyone, today we are going to discuss the topic of health issues among communities in underdeveloped countries. Do you know that there are several factors that can lead to a rise in the health issues in these countries? These factors include economy, social economic constraints, environmental factors, governance issues, and also the withdrawal of international support. So first of all, I would like to welcome all of you and thank you for joining the discussion today. Before we start the discussion, let me briefly introduce the background of all of the guests today. We are glad to have Madam Chong, who is an officer from the Ministry of Health of Malaysia that has been enrolling herself in the pathology field for more than 10 years. Nextly, let's welcome Dr. Wu, who comes from the Ministry of Finance, and at the same time, she is also a professor working at the University of Malaysia for more than 15 years. Lastly, we have Miss Leong to be with us today, and she is a senior manager who has been working for the international organization for more than 10 years as well. According to the Cambridge Dictionary, an underdeveloped country refers to a country that is less developed economically than most others, with little industry and little money spent on education and also the healthcare. Since the countries are less economically developed, the people may face some financial problems or poverty in their daily lives. Hence, what is the relationship between the poverty and health issue in underdeveloped countries, and how the poverty could result in the rise of health issues? According to the American Academy of Family Physicians, poverty affects health by limiting access to proper nutrition and health foods, shelter, safe neighborhoods to learn, live and work, clean air and water utilities, and other elements that define an individual's standard of living. Consequently, people who live in low income or high poverty neighborhoods are likely to experience poor health due to a combination of these factors. For example, they have a higher probability of suffering from infectious diseases such as tuberculosis, malaria, AIDS, COVID-19, and also hepatitis, because they may not get appropriate treatment immediately right after they fall sick. Besides that, Yemen is also one of the countries that is categorized as an underdeveloped country. According to WHO, 46% of all health facilities in Yemen are only partially functioning or completely out of service due to shortages of staff, funds, electricity, medicine, and equipment, which has caused the local people to face a health crisis just exactly the same as what had happened in Afghanistan. So today I have prepared 3 questions to interrogate your insight, and all of the questions are closely related to the topic today. So the first question that I would like to ask Madam Chong is how you feel when you come across the news about people dying due to low living quality and inadequate healthcare system.
Firstly, I would like to express my gratitude to Mr. Tang for providing me with this opportunity to share my thoughts in the forum today. I also extend warm greeting to other esteemed panelists. As an officer from the Ministry of Health with a focus on pathology, I agree with your statement that nowadays most of the underdeveloped countries are facing health issues due to many factors. Notably, countries like Afghanistan, Yemen, and Uganda consistently grapple with these challenges. In response to your question, I would like to highlight 3 key factors contributing to health issue in this underdeveloped nation, which are government's issue, shortcoming in education system, and withdrawal of international support. First and foremost, inadequate health system governments within the Ministry of Health could lead to collapse in the health system of the country. This is because the Ministry of Health is unable to control, enhance, and solve the healthcare system in the country, thus the citizen will always live in the pandemic situation. To support this, let me take Afghanistan as an example. In Afghanistan, there are many densely populated areas such as Kabul camps built by the citizens that are crowded and have poor sanitation and hygiene that will give a significant risk for transmission to the general population. However, the Ministry of Health in this country is unable to solve this issue due to their incompetency, thus that only can allow the situation become worse. Turning to my second point, I emphasize the critical role of education system in addressing health issues. Unfortunately, in some countries, the Ministry of Health fails to prioritize the healthcare knowledge dissemination. We can clearly see this in the Afghanistan, which under the Taliban rule, they inhibited women from receiving education, thus lead to many women not have that knowledge about the sexual health and basic knowledge such as maturation, lactation, and pregnancy care. Apart from that, to refresh a point delivered by Mr. Tang just now, in an underdeveloped country, the community lacks access to the basic healthcare, such as the importance of hygiene, hand wash, sterile, and clean water to their health, as most of the time they are struggling to survive. Consequently, people consume whatever is available, even the water is contaminated or spoiled food. To support my point of view, there is a project conducted by a few researchers named the Bogan Project that conducted in the Uganda revealed that the educated people in the country have 70% less chance to contact infectious disease such as HIV or AIDS. Last but not least, in the underdeveloped country, they often rely heavily on the financial support from international organizations and stakeholders across the various sectors, including infrastructure, education, and healthcare. Consequently, the withdrawal of such support can lead to significant challenges. These challenges can be included like limited resource, financial barrier, and hinder accessibility to healthcare service. As a result, timely and adequate care within the healthcare system may be compromised. A partnership with other countries offers numerous benefits. For example, collaboration can bring in researcher, medical equipment, and also valuable knowledge. Researchers and analysts from the partner countries can focus on the local health issue, educate the communities, and contribute to vaccine development for prevalent infectious disease in that country. Additionally, they can provide insights to the local Ministry of Health, thus help them to improving the healthcare system by addressing its weakness. Furthermore, the international organization and stakeholder often act as donor. They providing essential medical equipment that aids in diagnosis, monitoring, and treatment across the wide range of medical conditions. That's all from me. Thank you so much for lending your ears.
Thank you, Madam Chong. Yes, I strongly agree with your perspective that insufficient health education development will lead to an elevation in the number of people suffering from the fatal health diseases such as HIV that cannot be cured through any medication for now. Since the local people may lack of health knowledge and they do not cultivate proper health habits, this will increase the probability of contact with the pathogens or bacteria because they will neglect the importance of keeping their environment clean and washing hands with clean or sanitized water. Okay, so let's move on to the next question. My second question is, what are the impacts that can be caused by the health issues in an underdeveloped country? And I would like to ask the opinion from Dr. Wu.
Thank you to our moderator, Mr. Ting, and greeting to all panelists today. So, what consequences could bring to the local people or the public health condition if the health issue facing by the underdeveloped country is not solved for a short or long term? Well, if you ask me as an Ministry of Finance and as an economist, I would say the first and foremost issue will occur is the increase of the health risks in the country. I totally agree with what Madam Chong said just now about the limited resource and financial barrier hinder healthcare accessibility, leading to a delay or inadequate healthcare service. For better understanding, let me show you guys an example. Tuberculosis, also known as TB, is a serious respiratory ailment that is highly contagious and can be transmitted through coughing or sneezing, especially in crowded settings. So the burden of TB is particularly prominent in rural areas where access to healthcare service is limited, such as in Afghanistan and underdeveloped country, requiring individuals to travel a long distance to seek for medical assistance. However, even when the successful reach the healthcare facility, there is a scarcity of TB medication and diagnosis results. It's sad but it's true. Therefore, lack of healthcare service and equipment only expose people to disease and raise the risk raise the risk of health. Besides, the health risks also increase due to high medical expenses, not only in underdeveloped countries but also in some middle-income countries. The private sector usually provide a better yet higher quality of healthcare service than the government sector. So it costs the poor unable to afford such high-quality service, thus the health risks will increase. So when the people's health cannot be guaranteed, what will happen is the public trust will start to erode. Next, the healthcare burden will also increase if the issue is not solved for a long term. Due to economic impact, the salary of healthcare workers decreased. A survey showed that prior to March 2022, thousands of medical employees were not paid out up to a 7-month salary. Therefore, migration of these medical employees occurs and led to understaffed clinics in Afghanistan. Massive migration that occur not only linked to financial instability but also the safety insecurity during the war-torn and post-conflict era. Alongside COVID-19, there are only 9 people healthcare employees per 10,000 patients in Afghanistan, compared to 2022.8 workers as the WHO recommends. Due to the pressure, financial, and safety issue, migration of healthcare workers increased. Thus, the number of understaffed clinics and hospitals increased as well. Therefore, the healthcare burden increased, and even worse, the healthcare system will collapse one day. Lastly, if the health issue is not solved for a long time, it will bring a serious economic effect to the country. The main reason is due to the loss of productivity of people in the country. As an example, in Afghanistan, public health issues can have significant economic impact due to the country's already fragile economic situation, compounded by ongoing conflict and political instability. Poor public health can have direct impact on the local economy. Like what I stated just now, increased healthcare works, and then increased healthcare costs, inability to access basic healthcare service lead to loss of productivity. Since people easily get sick, but it's hard to get care without enough medicine or healthcare service, it leads to a lower work rate, which then result in poor performance of employees, which ultimately affect their quality of their work. Thus, the economy of the country will decrease. Moreover, the potential decline in tourism or investment also occur due to a poor health reputation. Reputation can all contribute to economic downturn. So health issue can deter tourism and for tourist investment in Afghanistan. I believe that no one would like to travel in a country that could promise our health, even their people health quality, right? Therefore, due to the concern about infection disease and healthcare infrastructure, most of the tourists will be discouraged from visiting the country and investors from establishing business. Thus, the economy of the country will decrease. To sum up, health is wealth. Nothing could achieve without a healthy body. I'm convinced that the people health quality must always be the most concerning issue in a country. If a country couldn't solve the healthcare issue, it will lead to the healthcare system collapse, and then the economic system also collapse. Thus, every country, especially. Thank you.
Thank you for the answer, Dr. Wu. So from my point of view, I consider that economic impact is one of the major factors that will cause health issues to happen in an underdeveloped country. Because when a country does not have a stable economic system or financial income, this will cause the country does not have sufficient money to invest the most advanced healthcare facilities or even hire professionals from other countries, which may help to boost the local healthcare performance. Thus, having a stable economic system is crucial to ensure everyone in the country can get equal opportunity in receiving medical treatment when it is needed. So next we come to Ms. Leong. What solutions do you think could the international organization take to address these issues?
Okay, so first of all, please allow me to extend my heartfelt thanks to Mr. Tang. I'm really honored to have been invited to participate in this discussion. I also strongly agree with Dr. Wu's remarks just now. Health has always been a crucial pillar supporting a nation throughout history. It's not an exaggeration to say that a collapse in healthcare could lead to the disappearance of a country. And now let's get back to the question. These countries lack the ability to solve healthcare issues on their own, therefore they must seek assistance from international organizations. Hence, what kind of resolution that can be provided by these organizations becomes very crucial. Regarding this issue, many existing international organizations have already attempted various measures to address and contribute to its resolution. Among them, well-known organizations include the United Nations, World Health Organization (WHO), International Monetary Fund (IMF), World Bank, and so on. The first solution, also can be said the most straightforward and direct method, is providing financial assistance to the Ministry of Health in underdeveloped countries. The underdeveloped countries are typically associated with poverty among both the government and the people. The financial aid given supports government to implement a variety of policies related to healthcare. Meanwhile, the monetary aid from this sort of organization can help the government to reduce the burden of hiring manpower and purchasing medical supplies during project implementation. For example, the World Bank Group is dedicated to achieve health equality and financial protection to the beneficiary country by implementing the 2007 Health, Nutrition and Population Strategy. This strategy reduced the direct cost of care, such as organizing research fees for the poor at the point of service. By doing this, the accessibility of the poor to healthcare can be improved. Proceeding to the next solution, that will be strengthening partnerships and international cooperation. As we know, the exchange of information, resources, and expertise are enabled by fostering relations with neighboring or friendly countries. This exchange can help the participating countries learn from each other's strengths and improve their weakness. As far as I know, Asia's Franchise the Development (AFD) is working hard to develop regional epidemic detection systems for the neighboring countries of France, such as Morocco. It is a third world country maintaining diplomatic relations with France. So this type of systems allow the other third world countries to share their healthcare information with France. This is actually a very good policy to consolidate the healthcare conditions of often overlooked countries, especially the underdeveloped countries usually slightly out of touch with world information. Through centralization of data, enhancing transparency with these sorts of countries, we need to know not only can improve their domestic healthcare situation, but it can also effectively prevent the widespread transmission of epidemics in a timely manner. Also, the best and efficient practices with latest innovations in the field of healthcare can be widely disseminated in underdeveloped countries within a relatively short period by teaming up with a powerful nation or organization. The final resolution I suggested is addressing social determinants of health (SDOH) under the assistance of various organizations. The SDOH can be resolved by promoting education, ensuring security and proper nutrition, and also making sure the clean water intake and sanitation. These determinants particularly lack management and attention in underdeveloped countries, so lead to underlying health status. As the federal government's leading public health agency, Centers for Disease Control and Prevention (CDC) has a unique role in contributing to work on SDOH. To the best of my knowledge, the CDC is coordinating efforts to address SDOH by reducing tobacco use, improving access to healthy foods, changing the built environment to promote physical activity, and connecting people to clean care. And still, there are so many other solutions for addressing SDOH waiting for us to explore. So these are my thoughts on the matter. Above are some of the solutions that I believe can significantly help improve the healthcare systems of underdeveloped countries. Health issues in underdeveloped countries have persistently existed. However, fortunately, due to the global spread of humanitarianism, an increasing number of international organizations are now joining efforts to assist them. We can draw lessons from implemented methods and continue to create new approaches with technological advancements to ensure that all people around the world have equal access to high quality of life. That's all for me today, and thank you for your attention.
Thank you for the answer, Ms. Leong. Personally, I support that strengthening partnership with international cooperation can help to address those issues because international cooperation can provide financial support, medical assistance, and counseling to the underdeveloped countries to help them to encounter those issues. International cooperation may also provide some of the necessary vaccines or medication to those countries when there is a pandemic happen, and they also can send some of the professional to those countries in order to train the local medical personnel to ensure that every diagnosis is accurate. As a result, this may help to reduce the probability of death due to mistreatment or delayed treatment. So we have reached the end, and I appreciate everyone's involvement in this forum, especially the knowledgeable and beneficial answer that you guys have provided to me. Before we end the discussion, allow me to make an overall conclusion about about what we had discussed just now. According to World Vision Australia, people who live in poverty struggle to meet basic needs, including having limited access to foods, clothing, healthcare, education, shelter, and also safety. Since what are the local people can do to improve their living standards is not much compared to the government's action, the government plays a vital role in ensuring healthcare services are well funded and run by the well-trained professionals. This is to ensure that everyone can receive their rightful medical treatments and is not neglected by the government. So thank you for the guys joining the discussion today. Okay, so thank you all.